You went to hospital, you get treated, you did everything right, and then the insurance company says, denied. And nobody explains why. Not the hospital, not the insurance company, nobody. I have spent 8 years inside the system, working US healthcare billing, US insurance claims, denial management, and I can tell you right now, most denials are not random. There is a specific reason your claim gets rejected. And once you understand it, the whole system starts making sense. Stay with me for next few minutes, because whether you are a patient and trying to understand your bill, or someone building your career in RCM, this video is going to change how you see healthcare billing forever. First, what is actually a denial? Let me start from the very beginning, because I think a lot of people, even people working in hospitals, don't fully understand what happens after a patient walks out. When you receive a treatment from the hospital doesn't just send you a bill and call it a day. They submit something called a claim to your insurance company. This claim is basically a detailed document saying, here is what we did, this is the diagnosis, this is the procedure, and this is what it cost. Now, the insurance company receives the claim and then they start to review it. The denial, it happens when the insurance company look at the claim and they said, we are not going to pay for this. Rejected. Dot. In my experience working with US healthcare system or in UAE system, the denial rate of first submission can be around 15 to 30% depending on the provider and the payer. This means for every 10 claim a hospital submitting to the insurance company, 3 of them gets rejected. This is not just a small number, this is like massive revenue problem, and somebody has to fix it, right? That's what RCM professionals do, and that's what I do. The real reason behind denial is not what you think. Now when people hear insurance denial, they immediately think, okay, the insurance company is being greedy and they don't want to pay. And look, I'm not going to pretend that it never happens, but honestly, in most cases of denials come from something much more specific, and most of the time, it's actually fixable. Let me walk you through the most common denial reasons I have seen in 8 years of this experience. First of all, this is the biggest one, the eligibility issues. Just imagine, the patient came in, the front desk checked their insurance card, everything looked fine, but the time the claim was submitted, the patient's coverage had been expired. Maybe they changed the job, maybe they missed a premium payment. The insurance company look at the claim date and says, this person wasn't covered on this date. Denied. This is one of the most frustrating denials that I have ever seen, because it has nothing to do with the treatment. It's just a timing and verification problem. And the next reason is authorization. Lot of procedure in healthcare require something called prior authorization. This means the hospital has to get approval from the insurance company before the procedure happens. I have seen cases, and this happened with some accounts that I managed, where a procedure was performed, the patient recovered perfectly, and nobody got the authorization before the procedure. And the insurance company came back and says, we never approved this, why did you do the procedure? Denied. What the hospitals do, they will put some pressure on us. Okay, you are the RCM professional, you fight for the claim, get paid. Of course, because the work is already done, so we need to get the payment. So that's how the procedure works. And the next one is coding errors. This is one of my favorite one, I guess, because I started my career as a medical coder. Before moving to billing, I was in IP coding, which is like inpatient coding. They will have like 200-300 pages of medical records, and I have to read each and every page so that I can code like 5 CPT codes. So coding topic will go to another session. Every single procedure, every diagnosis and every service in healthcare has a specific code, which is ICD codes for diagnosis, CPT codes for procedures. If the wrong code is used, one digit is off, then the claim gets denied. Sometimes it can be a simple typo. Sometimes it's a coder who didn't have a clinical documentation to work with. Either way, the result is same. Rejection. The next one is medical necessity. This one is more complex. Insurance company looks at the diagnosis and the procedure and asks, was this treatment actually necessary? Do the clinical notes support it? If the documentation doesn't fully justify why the patient has a specific treatment, the payer can deny it on the grounds of medical necessity. This is especially common in UAE healthcare as well as in US healthcare. I have dealt with this denial a lot. And the next one is timely filing. What is this timely filing? Every insurance company, they have a deadline to submit the claims. Okay, every month 30th, every month 15th. Before that, you have to submit all the claims, whichever it is. You have to finish it, you have to evaluate it, you have to code it, and then you have to submit it. Miss that deadline, even by one day, the claim gets rejected. I have seen hospitals lose genuine, valid claims simply because the submission was late. That revenue is gone forever in most of the cases. Alright, what happens after a denial? You might have some question. So the claim comes back denied. What happens now? This is where the denial management team comes in. And yes, I have worked in that team too. When a denial lands, the first thing we do is categorize it. Is this a hard denial or is this a soft denial? What is that hard denial? What is that soft denial? Sure, I will explain. Soft denial means the claim can be corrected and resubmitted. Maybe it was like a coding error, maybe authorization or any documentation needs to be attached. Sometimes what the payer will do, give me some justification like medical records or something so that we can get this claim paid. That is soft denial. A hard denial means the insurance company is saying that this claim is not going to get paid. Period. In these cases, this claim requires an appeal, and appeal requires a completely different approach. Clinical documentation, letters of medical necessity, sometimes peer-to-peer reviews between the treating physician and the insurance company's medical officer. They might have some officers. In my current role at American Hospital Dubai, claims evaluation is a major part of what actually I do. And I can tell you the difference between a hospital that manages a denial well and one that doesn't manages the denial properly is literally millions of dollars, millions of dirhams in recovered revenue every year. Most of the patients, they never see this process. They just get a confusing bill in the mail. But behind the scenes, there is an entire team of RCM professionals fighting to make sure the right payment comes through. You might have a question, what this mean for you, whether you are a patient or building a career. Now let me bring this back to you personally, because depending on why you are watching this video. If you are watching this because you got a denial claim and you are frustrated, here is what I want you to know. You have a right to appeal. Always, every insurance company has an appeal process. Get the denial reason in writing. Ask the hospital billing department to help you understand it. It can be overturned, especially it was denied for like eligibility or any authorization reasons that weren't your fault. Don't just pay your bill that you don't understand. Ask questions. Now, if you are watching this video because you are interested in RCM career, I want you to hear this clearly. Denial management is one of the most valuable skills that you can build in this entire industry. Hospitals are constantly losing revenue to denials. Anyone who can systematically reduce the denial rate and recover revenue is genuinely valuable, either in US market or in UAE, wherever it is. And this is not a job that AI is replacing anytime soon, I guess. Because those denials requires a clinical understanding, payer knowledge, negotiation and judgment. This combination is hard to automate. This industry rewards the people who truly understand how the money moves. So that's the real story behind insurance denials. If this video is useful to you, please subscribe. This video is going to be very useful to you. I'm going to make so much useful content in this channel. If you have any questions, drop them in the comment box. I'm Ashik and I will see you in the next one.